I'm Amy Dourgarian. I work in the emergency department as a physician. I have always wanted to be a doctor. I don't remember ever wanting to be anything else. I remember probably first grade where they ask you to sort of draw a picture of what you want to do when you grow up, and I drew an ambulance. My dad would help me dissect the Thanksgiving turkey, and I don't think there's anything else I've ever wanted to be. I was the first to graduate from college, the only medicine person, the only medical person at all in the family. I don't tell a lot of people I'm a doctor, but they tell everybody that I'm a doctor. Salem Hospital is a great place to work. You know, you get a lot of support. The staff are all really nice. Never really had problems with any of the other physicians on staff. The nurses are great. I think it's a really positive place to work. Daily life in the emergency department is a little bit of everything, which is why I like it. You know, there's days that are completely exhausting and you're mentally exhausted, you're physically exhausted because you're running around so much. But there's a lot of rewarding days. You know, you help a little old person that fell, or, you know, you help somebody feel better with their breathing, or you help a little baby with a fever. Just little things that I think are really rewarding in their own way. And then there's big rewarding ones where, you know, you bring somebody back that was really sick and needed some type of intervention that you're able to help them with. Went from being very sick and on death's door to being much better and going to the hospital and surviving. I like emergency medicine. I don't think I would switch to a different occupation or a different field. I've thought about if I were injured and I couldn't do emergency medicine, what I would do instead. I don't know if there's anything else that appeals to me that I would want to do. I think being a doctor is tough and rewarding at the same time. People getting into medicine now really kind of know up front that there's all those challenges, and they still want to do it because they still want to help people. It's the cliche of, you know, I go into medicine to help people, but we really do. I mean, you want to help people and make them better and fix people, and that's what we try to do.
My name is Maurice Collada, and I've been a neurosurgeon here in Salem Hospital since 1983. What prompted me to go into medicine? It was actually prompted by a profound experience that happened to my family. One of my sisters, an infant, had been saved by a physician who had just recently trained in the United States. I'm from Cuba. So that never left me how profound an impact a physician can make in people's lives. I had from early on in life a deep fascination with the human mind, reading a lot of psychology, a lot of philosophy. As I went and followed my passion for medicine, I started becoming a student of the human brain and understanding the relationship between that and the mind. It drew me. It's been a pride and joy that I ended up in Salem, Oregon by accident, but it's been one of the best accidents that have ever happened to me. As I finished my training, I literally was frustrated not finding a residency anywhere, and ended up actually finding a piece of paper inviting a neurosurgeon to come up to Oregon. But from the moment I arrived to Oregon, I fell in love with the state and ended up at Salem, Oregon to my great luck. Salem Hospital means everything to me as far as my professional neurosurgical life. I get a tremendous satisfaction from human contact, from being able to deal with my colleagues, to deal with the nurses, to deal with all the folks that give of themselves for medicine. I believe to the core that the physicians are a very caring group, that we deeply care for every patient we come in contact with. The idea that I have been able to train myself to have the privilege of helping somebody in their moment of need and getting them to a state of wellness is immensely satisfying.